Welcome to our deep dive into autoimmune epilepsy, a complex neurological disorder where the body's own immune system turns against the brain, triggering seizures. This video will explore the causes, mechanisms, symptoms, and management of this challenging condition, shedding light on what happens when your immune system attacks your brain. So, what causes this immune system misdirection? The exact trigger for autoimmune epilepsy remains somewhat mysterious, but it's believed to stem from a breakdown in immune tolerance. Instead of recognizing brain cells as self, the immune system mistakenly identifies specific brain proteins as foreign invaders. This can happen after an infection or in association with other autoimmune diseases. Certain antibodies like anti-MMDA receptor antibodies, anti-LG1 antibodies, and others are frequently identified in patients with autoimmune epilepsy, indicating an immune attack targeting these specific brain components. Think of it as a case of mistaken identity, with potentially serious consequences. Now, let's delve into the pathophysiology, or how this attack unfolds. When these autoantibodies, the misdirected immune soldiers, bind to their targets in the brain, they disrupt normal neuronal function. This interference can affect synaptic transmission, the communication between brain cells, alter neuronal excitability, and ultimately lead to seizures. Specifically, the disruption of ion channels and receptors critical for brain function, such as MMDA receptors or LGI1 proteins, alters the delicate balance of excitation and inhibition in the brain. This imbalance makes the brain more prone to generating abnormal electrical activity, resulting in seizures. Imagine a finely tuned orchestra suddenly playing out of sync, leading to chaotic and unpredictable results. Autoimmune epilepsy is considered a relatively rare condition, but the true prevalence is likely underestimated. This is because it can be difficult to distinguish from other forms of epilepsy, and the diagnosis often requires specialized testing. The incidence is higher in individuals with a personal or family history of autoimmune diseases. Ongoing research is dedicated to better understanding the exact numbers and identifying populations at higher risk. The signs and symptoms of autoimmune epilepsy can vary widely depending on the specific antibodies involved and the brain regions affected. However, some common features include new onset seizures, often focal seizures, meaning they originate in one area of the brain. Rapidly progressive cognitive decline, memory problems, behavioral changes such as psychosis or anxiety, movement disorders, like involuntary jerking or stiffness, and sleep disturbances. Because of the diverse symptoms, it is important to seek medical advice and get tested so you can have an accurate diagnosis. Diagnosing autoimmune epilepsy can be challenging. It often involves a combination of neurological examination, brain imaging like MRI, electroencephalography (EEG) to record brain electrical activity, and most importantly, blood and cerebrospinal fluid testing to detect the presence of specific autoantibodies. A positive antibody test, along with clinical features suggestive of autoimmune involvement, is crucial for confirming the diagnosis. Remember, a timely and accurate diagnosis is key to initiating appropriate treatment. Autoimmune epilepsy isn't one monolithic disease. It encompasses various subtypes depending on the specific autoantibody involved. Some common examples include MDA receptor encephalitis, LGI1 encephalitis, and SASPR2 encephalitis, each targeting different brain proteins and often presenting with unique clinical features. For example, MMDA receptor encephalitis is frequently associated with psychiatric symptoms, while LG1 encephalitis may be linked to facial-brachial dystonic seizures. Knowing the specific antibody involved is vital for guiding treatment strategies. The treatment of autoimmune epilepsy focuses on two primary goals: controlling seizures and suppressing the autoimmune attack. Seizure control is typically achieved with anti-seizure medications, just like in other forms of epilepsy. However, the cornerstone of treatment lies in immunosuppression. This often involves corticosteroids, intravenous immunoglobulin of LAMA, plasma exchange (PLEX), or other immunomodulatory agents to dampen the immune system's activity and reduce antibody production. In some cases, particularly when associated with underlying tumors, tumor removal is also essential. Unfortunately, there are currently no proven methods to directly prevent the development of autoimmune epilepsy. However, maintaining a healthy immune system through lifestyle factors such as a balanced diet, regular exercise, and adequate sleep may play a role. Prompt treatment of infections and management of other autoimmune conditions might potentially reduce the risk, although more research is needed in this area. Be sure to consult your doctor for more information. The prognosis of autoimmune epilepsy varies depending on several factors, including the specific antibody involved, the severity of the initial symptoms, and the timeliness of diagnosis and treatment. Early diagnosis and aggressive immunosuppressive therapy often lead to better outcomes. Some individuals may achieve complete remission, while others may require long-term management of both seizures and immune dysregulation. research continues to investigate new therapies and strategies to improve the long-term outlook for individuals with this condition. Recent advancements include the development of more targeted immunotherapies and a better understanding of the specific mechanisms underlying neuronal damage, paving the way for more effective treatments in the future. Keep checking for updates from your doctor.